March 20th, it is LFS Awareness Day, Li-Fraumeni Syndrome Awareness Day. This is being presented by Living LFS. We are a patient support organization to support people with Li-Fraumeni syndrome. You can find out more about us at either of the websites listed on the bottom of this slide, lfsawareness.com or livinglfs.org. My name is Andy Last. I'm the president of Living LFS. We are an all-volunteer organization, so everybody that is pulling together all the resources and time and effort for this is all doing so on a volunteer basis. And just to give you a little idea of what we've got planned today, this event is being recorded. It will be being made public later on. So if you want to be participating, but you don't want to be in the recording, as many of you have done, you can just turn off your camera, turn off your microphone, and you won't appear in the recording. But obviously, we would love to see your happy faces if you would like to be a participant in the live recording as well. So the events for today, we are going to have a presentation on mindful self-compassion from Camella Rising. She's a doctor and research fellow at the Clinical Genetics Branch at the National Cancer Institute, as well as from Amelia Coffaro. She is a LFS patient navigator, MSc facilitator, and certified yoga therapist. Following that, Carly Grant, our brand new member of the Living LFS board. She's our medical advisory board chair. She's a senior genetic counselor at Mass General Cancer Center. She will be doing Ask a Genetic Counselor presentation. If you saw in the support group on Facebook, she was asking for any of your general genetics questions. She will be answering those today. And if you brought questions to the meeting, she will be able to answer those, assuming that they are general. Otherwise, we will give you her contact information so you can contact her directly after the meeting. And then we'll also have Jackie Herigodt from Imerman Angels. They are providing one-on-one cancer support, and she will explain a little bit about the Imerman Angels Mentor Angels program as well. And then, of course, today is the 49th birthday of Living LFS founder Jennifer Mallory. She was born March 20th, 1976. She died October 5th of 2020 of metastatic breast cancer. And she is the reason that Living LFS exists. She is the reason that we are able to provide as much support as we are. So we will do a little tribute and birthday celebration for her later as well. All right, Amelia, the floor is yours. Thank you so much for being here today.
Yeah, awesome. Thanks, Andy. Well, hello, everyone. I may have met some of you last year at camp. Some of you might be new faces, but it's so good to be here. Thanks to Living LFS, thanks to Cam and the NCI team, and happy birthday, Jennifer. So my name is Amelia Coffaro. I am a young breast cancer survivor. I live with Li-Fraumeni syndrome. And as Andy said, I'm a patient navigator and a mindful self-compassion trained teacher and facilitator. But before we jump into all of the education piece, I thought we could start with an experiential practice. And so this is just a really nice way to transition our attention and our presence from whatever we were doing before this meeting and just give ourselves a minute to really bring our hearts and our minds into this space. So this is a guided practice and you can choose to participate if you'd like. Otherwise, if you just want to turn off the camera and listen, kind of see what is this about, you're also welcome to do that. And I'll also say that if at any point you are practicing and you feel like you need to stop, if emotions come up and they feel too overwhelming, we always encourage you to do what's best and honor your needs. So if you'd like to practice, I will invite you now to just take a minute to find a supportive and mindful posture. And really this means anything that feels comfortable but alert. So you can choose to stay seated in a chair. You could choose to lie down. And once you have found a place of comfort, just take a moment to bring awareness to the feet. So uncrossing the feet or the legs if they're crossed, letting the feet either be flat to the earth or the legs straight out in front of you. And then you can take the palms to rest face up or down on the lap or by your side. Or you could take a hand to the heart and a hand to the belly if you're feeling like you need something really supportive today. And if it feels comfortable, go ahead and close the eyes or just rest your gaze very gently on any point in front of you. We're going to start this practice by listening to the sounds in the room. So you can start to notice any sounds that might seem far away. So that could be far away within the room that you're in, or maybe even expanding your listening outside of the room that you're in. And no need to identify the sound or name it, just notice that sound is present. And then start to notice any sounds that might seem nearby. It could be the sound of my voice, it could be the sound of your own breath. And now in your mind's eye, in your imagination, start to find and sense your own body in the room. And perhaps taking a moment just to welcome yourself into the room, into our virtual space. Really greeting yourself with an inner smile of kindness, an inner smile of warmth, of welcome. So really inclining your own awareness towards yourself like you would a dear friend or someone that you love. And now dropping your awareness into the body. And feeling, noticing any sensations present in the body right now. Notice, are there any pleasant sensations? And if so, can you take a moment to appreciate them, to savor them? And then notice, are there any unpleasant sensations? And if so, can you make some space for them? So allowing them to be here, if only for this moment. So remembering that you're not alone, that uneasiness, discomfort are part of the human experience. And if there is discomfort, can you let your heart just soften a little bit around that? Be a little tender with yourself, simply because this is so. Or maybe even offering yourself some words of kindness, like, it's okay, I'm here for you. Whatever words feel true for you today. And then as you feel ready, we can gently begin to let this practice go. So bringing our attention back to the feet, sensing any support of the space beneath you. Wiggling the fingers, wiggling the toes. And then just taking a moment to pause and appreciate all of the efforts, all of the good intentions that brought you here today, which are already an act of kindness, already an act of self-compassion. And then when you're ready, you can open your eyes or lift your gaze and return your awareness back to the space. So next slide, please. All right. So hello again, everyone. If you're just joining, I'm Amelia Coffaro. I am a young breast cancer survivor living with Li-Fraumeni syndrome I'm a patient navigator, and I'm a trained teacher and facilitator in mindful self-compassion. This is a slide that includes a photo of my mammogram and my chemo chair that I wanted to share with you. So my journey with mindful self-compassion began about 12 years ago when I was diagnosed with late-stage breast cancer and LFS at age 28. I was personally just fascinated when I saw these tumors shaped like hearts on my mammogram, and that really became a turning point for me in my own personal healing and well-being, and on my professional path, really educating people on the role of mind-body practices like mindful self-compassion to support our mental and emotional well-being. And really, when I say our, I mean people who are experiencing cancer. Next slide, please. So by definition, mindful self-compassion is the intentional act of being kind towards ourselves in moments of difficulty, suffering, or perceived failure. And in this context, we really define suffering as wanting something to be other than it is. The purpose of practicing mindful self-compassion is really to know when we're under stress, when we're struggling, and to respond to ourselves with care and kindness. Mindful self-compassion was first defined and measured about 20 years ago by one of the world's leading experts and researchers on self-compassion, Dr. Kristin Neff. And out of her research, she and Dr. Chris Germer co-created a secular training program that's now supported by a very large body of scientific evidence. To date, we have about 3,000 articles and dissertations on mindful self-compassion in the psychological literature across many different patient populations. So veterans, children with autism, people with chronic illness, and people living with cancer. Mindful self-compassion can be practiced in two ways. So the first is cognitively, and we do this by training the mind, learning how to cultivate and deepen our inner awareness and a kind inner dialogue through the practice of mindfulness. And the other way is behaviorally, so taking action to alleviate suffering, to learn how to self-soothe. So you might be doing some of these already, you probably are. For example, having a cup of tea, taking a walk, having a good cry, talking with a friend, anything that you ordinarily do as a part of your self-care in your daily life. And many people also assume that self-compassion is primarily a soft skill or quality and very receptive. And that's true, but self-compassion can also be what we say fierce. So the tender part of mindful self-compassion, or what we say is the yin side, really contains attributes of being with our pain.
It says it's connected, but it's not.
Of being with our pain, being with our discomfort in a very tender way. So you could think of this as comforting ourselves, reassuring ourselves, just validating what's true for us. And then the yang side of self-compassion, that fierce side, is really associated with protecting, providing, and motivating ourselves. So these are two aspects of self-compassion that are different, but equally essential ways of caring. While mindful self-compassion includes fierce and tender, we tend to focus more on tender because we need to nourish ourselves first before we step out into the world with courage and strength. So there are three main pillars or elements of mindful self-compassion. The first is mindfulness, which by definition is awareness of the present moment without judgment. It's simply a state of awareness. So in mindfulness, we're not suppressing or avoiding what we're feeling, nor are we letting our thoughts get carried away and identifying every thought as a truth. Mindfulness just allows us to become aware of what's painful and turn towards it, to really be with something as it is. And this is the sort of prerequisite, we could say, for compassion to arise. So that second pillar is self-kindness. It's actively soothing our pain or discomfort with a kind inner dialogue. We could think of this as the how of how we respond to our pain. So we'll talk a little bit about this later, but having that self-kindness dialogue versus the inner critic. And then the third pillar is common humanity. So feeling a sense of connection to others, recognizing that life, that people experiences are imperfect. There are several benefits to mindful self-compassion, and I just want to highlight a few. Mindful self-compassion has been shown to support adaptive responses to challenges like trauma and chronic illness. People experience fewer states like depression, anxiety, stress, shame, and negative body image. It can reduce self-judgment, so that inner critic that all of us have probably experienced, right? That part of us that's like, oh, you failed, or oh, you didn't do good enough. And really overall, what we're trying to share here is that self-compassion is a strength that offers resilience when faced with difficulty, and it's powerfully linked to well-being. Sometimes people might have some misconceptions or some doubts about self-compassion that prevent them from practicing, and this is normal. There are two here that I really want to highlight. The first is that mindful self-compassion is a form of self-pity. What self-compassion reminds us of is that everyone struggles, right? That common humanity pillar. And self-compassion doesn't sort of like exaggerate the extent of suffering. So it's not a woe is me attitude. What we see in the research is that self-compassionate people are more likely to engage in perspective taking rather than focusing on their own distress. And the second is that mindful self-compassion is a form of weakness. So as I mentioned, it's a strength that offers resilience when faced with difficulty. And again, the research shows that people are better able to cope through tough situations. So it's not that self-compassionate people are afraid to show emotion or afraid to fail or experience something challenging. It's just that when that happens, they don't beat themselves up if it does. Self-compassion is also not just an idea. It has several qualities that can actually manifest in our body. And I just want to highlight three here. So the first is that it helps us to develop a kind inner dialogue. It really gives us the opportunity to respond to our suffering and challenges in a way that soothes our own pain and taps into the caregiving part of the brain. And when we do this, we release oxytocin. We increase feelings of trust, calm, safety, and connectedness. And the reason that that's so essential is because self-criticism, the opposite of self-kindness, has a very different effect on our body. So that self-critic, that internal dialogue, it's an emotional response. It can trigger the fight or flight response. It increases cortisol, but self-compassion actually decreases our cortisol. So the safer that people feel, the more open and flexible we can be in response to our environment and to challenges that arise. The second unique quality, and one of my favorites, is that mindful self-compassion is not self-esteem. So it's not contingent on an outcome or something that we do. The heart of this really says, I'm worthy of kindness and love towards myself no matter what. And we all have that innate capacity to access that sense of compassion in any moment. And the third is that it meets us in any moment. So it's applicable in any situation that feels challenging or overwhelming. I think often we see our self-care practice as something that we have to do outside of, the time that we're going through a challenge. It's our yoga practice, it's our gym practice. But mindful self-compassion can happen while the challenge is present. And this has been shown to reduce psychological distress, both for people in active treatment, in survivorship, and caregivers. Okay, so during our sessions, our goal is really to support people in learning skills to explore the connection between self-compassion and well-being, both theoretically and experientially. We want to support you in developing mindful awareness of challenge and difficulty, make meaningful connections between your experiences and the larger human experience, learn how to embrace difficult emotions with ease, and learn how to self-motivate with kindness instead of criticism. So the last thing I want to say here is that we're not using this as a tool to eliminate difficult emotions or difficult experiences. We just want to learn how to cultivate the ability to identify and validate our experience and really move towards a gradual release of emotional resistance that could otherwise be detrimental to our own well-being. And I thought I'd close with this quote from Dr. Kristen Neff. And she says, by changing the way that we relate to our own imperfection and pain, we can actually change our experience of living. And I'm going to pass it over to Cam, and she's going to share with you a bit about how we are applying this in the LFS community.
I want to say, first of all, thank you very much, Amelia, for that. That was, it's great, you know, having participated in the mindful self-compassion training at the Living LFS Jennifer Mallory Family Camp. It's great to have that refresher. So I appreciate your time very much. Thank you. Camella Rising from the National Cancer Institute. The floor is yours.
Thank you so much. So, as Andy said in the beginning, I'm an LFS researcher, and I specifically focus on, what can we be doing in life to help ourselves flourish? And I'm thinking about psychologically, socially, physically, and I think that mindful self-compassion is really compelling for helping us flourish. And so I'm truly honored to have been invited to celebrate with you today. And I'm really thankful just for this opportunity to share with you a summary of results from the study we did at camp. So I wanted to start by sharing a quote from someone who completed the training because it nicely shows why we wanted to conduct this study and just the importance of resources that support mental health and well-being for people living with LFS. So this person said, we are really dealing with a lot on a daily basis living with LFS. Even if we're currently cancer-free and we don't have any scans coming up, there's just like this constant baseline anxiety. So to have some tool that we can use that can help us to be kinder to ourselves and to deal with bad news is invaluable. Next slide. There were so many, there we are. There were so many wonderful firsts for this study. As far as we know, this was the first mindful self-compassion skills training delivered to an LFS community, the first research of its kind at one of the family camps of Living LFS. And the first time that this wonderful team, Kat Wilsnack, who many of you know, is a social worker, mental health provider, Amelia there in the center, Dr. Rowan Forbes-Shepard, who some of you may have had the chance to meet, who's a psychosocial researcher at the NCI, and then Dr. Pyle Kinshaw, who is the principal investigator of the NCI LFS study, and of course, Andy. And what was really special was just the chance to work together as true research partners. And I can't emphasize enough how thankful we are to the Living LFS community and to contributors to the study specifically for allowing this. So thank you. Next slide. So on to the official business of the study, if you will. So the aims of the study were to determine if the mindful self-compassion skills training was feasible, if people would think it was acceptable and appropriate for two groups of people, for adults with LFS and for adult family caregivers of people with LFS, but they don't have LFS themselves. And we wanted to see if we could glean anything about the effects of participating in the skills training. So maybe some early ideas on the mental health benefits for the LFS community. Next slide, please. Thank you. So, can it be delivered successfully in the camp setting? A unique real world setting, but one that's important for Living LFS. And what are potential barriers and challenges to using mindful self-compassion in daily life? And what other supports and resources might be needed in order to make it easier to use it? Next slide. Thank you. So to be eligible, as I said, you just had to be, consider yourselves one of these groups, an adult with LFS or a family caregiver. And we just asked that folks who maybe just in the last 6 months had already done a mindful self-compassion skills training, that participating in the study might not be the best thing, but that was it. We wanted it to be very open to people. And there were 57 adult campers who received an email about the study, and we gave a pre-camp survey in order to see a little bit more about mental and social health before the camp and to invite people to participate in the skills training. And then after the camp, we assessed mental and social health. And it gave us an opportunity to ask those who participated in the training if they want to tell us a little bit more about their experiences through some focus groups. Next slide, please. Yeah, so for the actual training itself, so it was conducted in the same 90-minute session that a lot of the Living LFS camp sessions are set up as, and so that was convenient. And the practice, well, I really don't need to say much more because you had the wonderful example that Amelia just gave you of how you can open up through meditation with mindful self-compassion. It was very important to create a feeling of a safe environment, a safe place to share. And so that was a part of learning from each other through group introductions. And there were some pencil and paper type practices, asking questions about thinking on a time when a friend or a family member, a loved one was suffering and how you responded to that, and then turning that to ourselves. And we shared some of those reactions we had. And Amelia talked to us about cultivating loving kindness phrases, such as, may I be kind to myself in this moment. May I be happy, healthy, safe. And we closed with another mindful self-compassion exercise. And it was really important to us, too, to have Kat Wilsnack there with us to have a group discussion so that we could sort of process what happened and make sure we understand just the needs of individuals who had participated. Next slide, please. So the results, we were really pleased that, again, there were 57 people. So this is a substantial number of individuals who were adults who actually participated. And so we just wanted to see if of the 20 slots available per session, if about 70% would be filled, and we did achieve that goal. And you see here so in the darker shaded images are men, so we had some men as well as women. Next slide, please. As far as how acceptable or appropriate people who participated thought it was, overall, they thought they were very satisfied with the training, just the content, the teaching, the camp venue. But what I think is really nice to hear are some of the quotes from people. So someone said the instructor had a very relaxing tone made for this. Her own journey difficulty gave credibility to the tools and exceeded some people's expectations. And then again, just a bit like the first quote I said, that it means a lot, I think, to have somebody who is living with LFS be the person who's delivering the intervention. So we took note of that for sure. Next slide. So most people agreed with these questions that we asked about, do you think it's relevant to your concerns, mindful self-compassion, that is, that it would assist with LFS challenges, and would you recommend it? And folks generally agreed with these as well. Next slide, please. In terms of some information about how it affected people, we did hear some immediate effects, like I left feeling so at peace. And then we also heard from people who completed the post-camp survey a couple of weeks later that they still felt a bit less anxious. And we learned too that people had been using the techniques. And then this really strikes me every time I read it, is that someone mentioned using mindful self-compassion right away, coming home from camp, and then just a couple of days later having their MRIs and just waiting in the waiting room and putting their hand, that soothing touch over their heart, and saying, may I be kind to myself in this moment. They jokingly said, well, my cells are hopefully not rapidly dividing, and that they practice this kind inner dialogue until they were taken back to their MRI, and they found that to be helpful in that moment. Next slide, please. And I think that this might be one of my last results slides, but after in the post-camp survey, we did look at higher self-compassion scores and how they related to other measures. So, and we did find that there was a strong relationship with folks having a higher self-compassion score and reporting that they felt more socially connected, life satisfaction, had better global health, mental health scores, and a sense of meaning and purpose, and then lower anxiety, depression, and perceived stress. So very much in line with some of the things we see in larger studies. So that's promising. Next slide, please. This is not to say that there weren't some challenges. Being in a group and talking about these things and facing our suffering, acknowledging it can be difficult. So, you know, that the raw emotion, opening up in front of people whom I just met can be challenging, but also just practical things like remembering things we learned. I think a good problem, someone said they wished it was longer. And then about grief and anxiety, you know, just acknowledging that this is something that that's really a part of the living with LFS, and that can be hard to face. It's not for everyone. This tool isn't meant to be. And so someone said that it was a little too much for them, sort of like nuts and berries psychology speech. And that is perfectly okay. We definitely know that this is just one tool. And yeah, so we took close note of that as well. Next slide, please. Definitely interest in future trainings. People acknowledge that this was just, you know, the tip of the iceberg. They want to learn more, want a refresher. And so, you know, hopefully there will be more opportunities to engage with mindful self-compassion in the future within the community. Next slide. Yeah, so the training overall, it seemed to be feasible, acceptable, and appropriate, promising for improving mental and social health. And like I said, we really hope that trainings can be with, you know, longer practices can be considered in the future, maybe some alternate settings, virtual, like we are here today. And then also just to share that I'm also working on a project thinking about how young people would respond to a mindful self-compassion training as well. Next slide. Just a reminder that this resource that Amelia put together after the camp is available under resources and then complementary therapies on the livinglfs.org website. And it has some great links to practices and information about resources. And then last slide.
And I will actually put a link to that resource in the chat momentarily as well.
Great. Yeah, and just wanted to close again with a huge thanks to the Living LFS community. I cherish you and celebrate you and Jennifer today. So thank you so much for inviting me.
Thank you, Cam, so much. And Amelia, thank you as well. I really appreciate both of you participating today. It means a lot to have, you know, your involvement in the LFS community. So thank you. And I'm going to put that link in the chat right now that has the resources from Amelia. So that link will take you right to her little resource sheet. You can contact her for more information. And we will actually be working on putting together a mindful self-compassion event for the Living LFS community if there's interest in doing so. All right. Thank you both so much. Happy LFS Awareness Day.
Thank you.
Thank
everyone.
you.
See you later.
Thank you.
Bye-bye.
Bye.
And now I would like to introduce Carly Grant. She is the newest member of the Living LFS board. She's our medical advisory board chair. She's a senior genetic counselor at Mass General Hospital. And we had put in the chat in the support group on Facebook that if you have any general genetics questions, today is the day to get them answered. And Carly is here to provide those for us. Thank you for taking the time today out of your schedule to make yourself available for this as well.
Oh my gosh, it's my pleasure. This is super fun for me, actually.
Cool.
That weird.
Floor is yours.
Okay. Thank you so much for giving me this opportunity, and happy LFS Awareness Day. Thanks for the introduction. I'm excited to talk to you about some of the questions that you all submitted, and hopefully give you a little bit of just background of what I do and just my nerdy genetics background, because I'll give you a little genetics 101 first. So I'm going to get started, and I hope that the timing works out. Andy, let me know if I'm going over whatever.
You got it.
So in case you don't already know what a genetic counselor is, maybe you don't have one or you just have never heard of us. Generally, we are kind of master's degree trained healthcare providers. We work as a member of a healthcare team providing risk assessment, education, and support to individuals and families at risk for or diagnosed with a variety of inherited conditions. So we actually can work in a lot of different settings, including prenatal, pediatrics, general genetics. I work in cancer genetics, so I really only focus on cancer predisposition syndromes like Li-Fraumeni syndrome. So in terms of what we do in practice is we talk to people about the option of genetic testing, about the benefits of it, about common concerns. We look at the family history to evaluate the chance for hereditary cancer syndrome or other people at risk for one that we already know about, such as Li-Fraumeni syndrome. We would always make sure to be up to date on the latest on like health risks, in this case, cancer risks, medical management recommendations. We would, we help coordinate care with like specialists and making referrals. And so in some ways we're like almost like a social worker of Li-Fraumeni syndrome in a sense. And we can help support you with talking to family about this, talking to children, and just sort of providing general supportive and informational resources. So we're kind of like the point person or the quarterback for families with Li-Fraumeni syndrome. So I just wanted to do a quick review of the history of Li-Fraumeni syndrome, because I think that it helps to kind of review the history of Li-Fraumeni syndrome to sort of understand our understanding of it today, where we're at today. So you may know this already, but Li-Fraumeni syndrome was first described way back in 1969 by doctors Frederick Lee and Joseph Fraumeni, and this was based on a series of families that they had become aware of that had these very significant cancer histories and couldn't figure out what was causing it. So it took a long time to eventually link Li-Fraumeni syndrome to being caused by a mutation in the TP53 gene, and that link was made in 1990. And Li-Fraumeni syndrome has sort of been described as being associated with certain core tumors, which you probably know inside and out, which is really bone and soft tissue sarcomas, breast cancer, adrenal cortical carcinomas, choroid plexus carcinomas, brain tumors, and leukemias. What's interesting, though, is our understanding of what Li-Fraumeni syndrome is, what the cancer risks are, and how to manage it is really starting to change and evolve. When we were first offering genetic testing for Li-Fraumeni syndrome, we were really only offering it to families who more or less fulfilled the criteria or looked like those original families. So these were people that were presenting with these really significant family histories. But in the last, say, about 10 to 15 years, genetic testing has changed quite a lot in that we now tend to test people for a lot of different genes at the same time, not just one gene at a time. So I might see someone, for example, who is coming in to talk to me about their family history of, I don't know, colon cancer. And it's possible that they're getting tested not only for hereditary colon cancer genes, but also genes associated with other cancers, including the TP53 gene. And so what's been happening is we're starting to discover that there's a lot more of these mutations or variants out there than we thought. And so we're starting to realize they don't always match the family history. So maybe Li-Fraumeni syndrome isn't exactly what we first thought it was, but maybe it's a little bit more of a spectrum syndrome. And I think this is just something that, continues to evolve. Okay, so we're going to do a little bit of genetics 101 because I think this can be helpful in addressing some of the questions that you submitted. Some of you are probably really expert in this already. So I hope this won't be boring to you, and for others, maybe it's just a good refresher. So just really quickly, this is what I always do in genetic counseling anyway. Our bodies are made of billions and billions of cells. In the cells, we have what's called a nucleus, and that's where our genetic material lives. It's called DNA. DNA is packaged in these structures in that nucleus that look like X's. Those are called chromosomes, okay? So now, if you were to zoom in and look at one small piece of a chromosome, you'd be looking at one small piece of DNA. And we would call that a gene. A gene is a small piece of DNA. And we have about 20,000 different genes in our bodies. Every single gene plays a really important role in the body in telling our bodies how to grow and function, determining traits, things like that. We also have 2 copies of every gene because we always inherit one from our mother and one from our father. And we have these in every cell of the body. So it's kind of mind-blowing numbers if you can wrap your head around that. So every gene has a specific and important job to play. So the TP53 gene is a very important gene. We call it a tumor suppressor gene. And we call it that because its normal job is to make sure that we don't make tumors. Its normal job when it's working is it does all these crazy things you can see in this graphic here. You don't need to understand it. But basically, these are all different ways that this gene can help to make sure that the cells of our bodies aren't growing and dividing more than they're supposed to. Because when our cells get out of control in their cell growth and division, that's when a tumor can start, a cancer. So some people refer to this gene as a guardian of the genome because it plays so many roles related to preventing tumors from forming. So it's really important to have it working. That's the thing about it. And that's why I'm sure you've seen this type of thing before. That's why we know, because it's so important in preventing cancer, and we know that elephants have 40 copies of the TP53 gene. So guess what? They almost never get cancer. You know, people do get cancer. We only have 2 copies, those of us who don't have Li-Fraumeni syndrome. But if you have Li-Fraumeni syndrome, now you're left with just 1 working copy. So the risk for cancer is, much higher. Okay, so now I want to move on to the questions that you submitted, and then hopefully have time at the end for any additional questions. So let me just move things around here so I can see. Okay, so in Li-Fraumeni syndrome, why does cancer suddenly happen or occur very young in some and older in others? And that's a great question. So you might understand a little bit about why people with Li-Fraumeni syndrome get cancer kind of so easily, just based on what I was just saying about the number of TP53 genes. But I want to kind of demonstrate it in a little bit more detail. And in order to do that, we need to talk about how cancer starts to begin with. So I want to just call your attention to these blue circles represent a cell in your body, okay? In that cluster of circles you see on the right is that like blob of circles is kind of like a cancer or a tumor. So let's talk about the difference between people who do not have LFS and the people who do have LFS. So people who do not have LFS are born with 2 normal and working copies of the TP53 gene. So they have every single cell of their body looks like that one on the top left from the very start. Okay, so now as that person goes through life and they get older and they're exposed to all the things that are around us, there is always a chance that there could be damage acquired to one of the 2 copies of that TP53 gene over time, but that would only happen in one single cell of the body. So that person's still fine, they have a second copy, but as time goes on, they could possibly acquire a second hit to the remaining copy, again, in that one cell of the body. So that cell could become cancerous at this point in life. But this process takes a long time, like decades, which is why when you think about the general population, when people get cancer, it's typically older, right? And you don't typically see people getting like multiple cancers. On the other hand, people with Li-Fraumeni syndrome are born with one of the two copies already knocked out from the very start in every cell. So all it takes is acquiring a second hit to the other copy in any one cell of the body, and that cell could be vulnerable to becoming a cancer. And that is this is like my long and drawn out way of saying that is why we tend to see cancers happening, or we can see them happening at much younger ages, and we can see multiple cancers happening. But it's still variable from one person to the next. It's not always totally clear why. There could be other things modifying risks in our body that we don't totally understand yet. It could have to do with environmental exposures. It might even just have to do with a particular type of mutation that that person or that family has. So there are certainly factors that can play into that. I think we're not quite there in our in a really detailed data-driven understanding to be able to modify people's risks who have this, but we're getting there. So anyway, that's kind of the bottom line there. Sorry, I know that was a lot of information. Okay. So there were some great questions and really, really important questions submitted as well about what I should be doing to protect my children with Li-Fraumeni syndrome, which I assume that question was asking about like screening and medical management. So I'll do my best to address that. So there are now guidelines that are in the NCCN, which is what we refer to a lot for cancer screening guidelines, the National Comprehensive Cancer Network, that incorporate the Toronto protocol for pediatric cancer screening in Li-Fraumeni syndrome. There are certainly variations to this. It doesn't mean that necessarily every child is going to be followed exactly like this. Sometimes the recommendations differ depending on the family history. But basically, these are kind of the general recommendations that I think a lot of people follow, which is to have a comprehensive physical exam and neurological exam every 6 to 12 months, having a low threshold for reporting any concerns, whole body MRIs starting from the very beginning, basically in infancy, brain MRIs, which could be part of the whole body or be separate, and then abdominal ultrasounds to screen for those adrenal cortical carcinomas, which sometimes, a lot of institutions do those like every 6 months, not every 3 to 4 months, but somewhere in that range. Those are the general recommendations. And hopefully the copies of these slides will be available after, so that if people want to review this, or I'm always happy to answer questions or send this information. So don't feel you have to memorize it on the spot. Okay, moving on. Let me just make sure. Okay, so yeah, so this was another question that was submitted. Again, really, really important. How do I explain LFS to my kids? This is so heavy and life-altering, especially watching a father have cancer and pass. Yeah. I mean, we have done talks just on this one topic. And actually, Jackie Shenda, who's also on the board, a good friend of mine and someone that I work with a lot, she wishes she could be here today. She and I have given several talks on this. So some of what I'm going to show you is related to what we've talked about previously, but certainly not easy. And I'm not going to get into it in as much detail as I might if I were giving a whole talk on it, but I thought at least giving some tips to start would be helpful. Well, first of all, this is related to the talk you just saw on mindful self-compassion, I think, because I feel like my number one recommendation is to make sure that you're taking care of your own kind of mental and emotional health first as best as you can before talking to kids, which I know is no easy task. But it's really important to kind of do that oxygen mask first on you. Another tip is to kind of just sort of trust yourself in knowing your child and how you have talked to them about other things before. Again, I realize this is very significant and probably unlike anything else, but just, I guess, just trusting that you know best how to approach your child. And then another really important piece is really to take your time and know that having conversations about Li-Fraumeni syndrome, it's not going to be, you know, a one shot thing. It's probably going to be very gradual. It's going to take a long time, especially depending on the child's age and developmental stage. And again, there's a lot of data on all this that I'm not going to get into today, but I'd be happy to another time. So I think one thing that is recommended certainly, which I think is probably recommended in other settings with kids as well, is really just sort of allowing their questions and reactions to guide the information that you're giving to them. And sometimes also just what's happening in the moment. So, you know, sometimes there's an opportunity to get a little bit deeper into something because maybe it's time to go to the doctor or the hospital for screening, and, you know, these questions start to come out. So that might be a natural time to talk about things. And before I forget, I mean, speaking of going to the hospital or being in a car, you know, or driving somewhere, it can actually be a really great time to talk to kids, especially teenagers. I think sometimes just this idea of not looking directly at someone and not having direct eye contact, it can be a time that makes it a little easier to talk about difficult topics with kids. So other more specific guidelines about talking to kids would be trying to normalize if it's at all possible. So if there's other family members that are getting screening, especially family members that are, you know, doing well, it's nice to be able to refer to them. Like from time to time, you'll go to the doctor for some tests, just like Uncle Joe does. Any way of framing the information in a little bit of a positive way. And it's not to say you're supposed to, you should sugarcoat any of this, but I think, you know, the purpose of going to the doctor and getting screening is really to find cancer early or prevent it. And so, you know, framing it that way for kids of, you know, we're going to do this because it's a way of keeping you healthy rather than like, you know, oh, there's a high risk for cancer. Yeah. And then I guess last but not least, working with the medical team to make sure everybody is on the same page about the kind of language you're using to talk to your kids, or you know, any particular things you do or don't want included. The medical team should be happy to work with you on that. And then there's also resources out there. These are some books and booklets can be really helpful in guiding these conversations. And there are definitely books out there. So like Robot Music is a book that is geared toward really young children that are sort of the preschool age, to help them feel more comfortable going to the hospital, getting screening. So that's a good one. Oops, sorry, my dog might bark in a second. LFS and Living My Best is geared toward, I think, 8 to 13-year-olds. So that's a little bit of the more school age set. And then Emily Goes to the Doctor, I think, is also for young kids. And then Living LFS has a really nice page with some additional books listed and resources as well. So those can be a helpful jumping off points. Okay, the next question. I was advised to have radiotherapy by my team, but I know this is not advisable for LFS. Is proton beam therapy a better alternative, or should I just forego any treatment involving radiation? Great question. So people with Li-Fraumeni syndrome are known to be extra sensitive to the carcinogenic effects of radiation. So that gets talked about a lot. But the reality is that there are cancers where radiation treatment is the most effective treatment for getting rid of the cancer and, keeping that person healthy. So there are absolutely times when it would not be contraindicated because it is required to treat a cancer. Sometimes there may be alternative options, And these things can be weighed, the pros and cons of different ways of treating cancer that, should, of course, be discussed with the medical team in light of having Li-Fraumeni syndrome. But that's the general consensus with radiation treatment and avoidance. Proton beam radiation is a more focused, precise way to deliver radiation, but whether it's recommended for a particular person will depend on the type of cancer, the location of the cancer, and other factors. And I'm not even sure if proton beam radiation is available at every institution. So it may depend on that as well. But that's, again, something that would need to be discussed with the medical team. And then another, I guess, question pertaining to radiation, a lot of people ask is, whether they should be avoiding things like dental x-rays or other routine screenings that involve radiation. And the consensus there is that generally the amount of radiation in these types of tests are very low, and they probably don't need to be totally avoided. But in some cases, it could be a thing where maybe for most people, they're recommended to get dental x-rays every year, but maybe you can talk to the dentist about, hey, is it okay if I or my child only has it every other year or every 3 years or something like that? So I think having those discussions, again, would be appropriate, but generally it's a very low levels of radiation there. Okay, another question that came in is, what is a recommended dermatology skin checks for people with Li-Fraumeni syndrome? Is it yearly? I have several suspicious looking moles that I've had for years, but I don't know if they're dangerous or just weird looking. So these are the adult screening guidelines for Li-Fraumeni syndrome. In fact, I actually took this right from a packet of information that my group at Mass General created that we give to people with Li-Fraumeni syndrome, because it's just sort of outlined nicely with the different screenings and cancer risks. Again, these can change, they may vary a little bit. But as of now, the current recommendation is to have annual dermatology examinations starting at age 18 for people with Li-Fraumeni syndrome. With that said, I pointed an arrow to this really important little statement down here, which is education regarding signs and symptoms of cancer with prompt response if concerned. So I think everybody would say, look, if you have something going on that you are worried about, something suspicious on your skin, and you feel like, I just had a derm examination, maybe I shouldn't go back in for another year or something. No, you definitely should call the doctor, because we just never know. We just never know, and we just have to stay on top of this stuff. So I think if you have any concerns, you should definitely you're definitely encouraged to call the dermatologist or call the doctor about it. Okay, another question that came in was, for those of us that present with VUS LFS, what are your recommendations for medical management and mitigation of risk? So I don't know if everybody knows what a VUS is, so I'm going to do a little bit of education here, and then we'll talk about what we would recommend. So whenever somebody goes in for genetic testing, there's always 3 possible results that can come out of it. Positive is what we call having an actual pathogenic variant, or otherwise known as a mutation, meaning we know you have a change in the TP53 gene that stops it from working. And so that would mean you have Li-Fraumeni syndrome. Negative means no Li-Fraumeni syndrome. And then there is this third result that sometimes people get in genetic testing called a variant of uncertain or unknown significance. And we call it a VUS for short. These are actually pretty common. And it means that there was a change or an alteration found in the TP53 gene, but that it is not clear if that particular change or difference is actually stopping the gene from doing its job, right, to prevent cancer. Is that change behaving like a mutation and putting the person at an increased cancer risk, or is that change completely harmless and makes no difference whatsoever? So that's what that result means. And what we say, just in general in my group, when somebody has a VUS result, for the most part, is we pretty much tell them we will contact them if it gets reclassified. It's like sometimes over time, the genetic testing lab can study these types of variants, and they're able to, over time, put it in a specific category. When that happens and they get reclassified, they usually end up being reclassified to harmless, to benign. Okay, so that's good news. In the meantime, when somebody has a VUS result, we do not change their medical management at all, and we do not recommend testing family members. I would say, I would say if somebody has a TP53 VUS result that they're worried about, I would definitely check in with the provider who ordered the testing to find out what the plan is for recontacting you if it gets reclassified, because sometimes they don't have a plan, and you definitely want to know if there's a change to that. So a VUS can be a really uncomfortable thing to live with, and I'm sure doesn't feel good, especially if you know about Li-Fraumeni syndrome, but we generally do not worry about these, and we really just wait and see if we can get more information. So hopefully that's somewhat reassuring. And then a few other questions that came in are that I'm just going to address quickly, because these fall to the category of I'm not sure, or you might need to ask your doctor, is whether there's other conditions in cancer linked to Li-Fraumeni syndrome. I don't really know of any. I mean, we talked about radiation sensitivity, but that's still kind of cancer related. But really, I think the ones that really have data behind them, I think, are really just the cancer risks. There may be other things we learn about over time, but I don't know of any really right now. In terms of preventative surgeries recommended for males, also, I don't think there are any currently preventative surgeries, just like for women, having double mastectomies as an option to prevent breast cancer is certainly one of the things that is, discussed. But I don't think there is an equivalent that I know of for men. And then there's a question about squamous cancers that keep on coming repeatedly. And again, I would just refer back to what I said a few minutes ago, is definitely call the doctor about that. I don't have, the answer to that. So I would always just go back to your medical team. All right, well, that is pretty much everything that I wanted to address in terms of the submitted questions. I hope I didn't go too crazy over time. I wanted to, if we have time, I'm happy to try to take more questions. I did include a link here to find a genetic counselor on the NSGC website. If you don't have one, you can also email me and I can help you with that. And then this is just a link that can be helpful with additional resources about talking to kids. So those are just a few things, and that's all I have for now.
Carly, I put a question in the chat that came from one of today's attendees regarding their specific variant in TP53. And I would assume that depends on whether or not it said likely pathogenic or uncertain significance. But I wanted to throw that out for you as well in case you want to give a brief answer to that one.
Okay.
I've received conflicting information regarding
yes.
whether or not I have Li-Fraumeni.
I see. I don't know off the top of my head. I would have to look into that, but generally, you have to look back at the genetic test report that, like Andy said, usually would say, it's a pathogenic mutation or it's a variant of unknown significance. Although sometimes these labs have a weird way of phrasing things. If you don't have a genetic counselor to refer back to, email me and I'll try to help you think about that or guide you in the right direction. So hopefully you caught my email address. I don't know. Andy, are they going to get?
She just messaged me and she said it shows as a VUS on one and likely pathogenic on 2 different reports. So it really sounds like this is
conflicting. Okay. Oh, conflicting. Yes. Oh, that happens sometimes. That is so frustrating. So I would say is that Kristen, I think.
Yeah.
Kristen, why don't you email me and we'll kind of take it offline. That can happen once in a while. It's a super frustrating situation. Yeah.
And then also Lori asked, posted that in the chat. Is anyone researching the difference between the mutation of TP53 and a deletion of TP53?
Well, a deletion is a type of mutation. There's a lot of different ways that I didn't get into this today, but there's a lot of different types of mutations. Sometimes it can be just like one little change in one of the what we call base pairs from one letter to another. Other times it can be that a chunk is missing. That's called a deletion. It's really the effect of the change. So sometimes a small change has a big effect, and sometimes a big change doesn't have much of an effect. But yes, I mean, bottom line is like definitely people are studying all the different types of mutations that can occur there. And, if somebody has a variant, these labs are really following, are we seeing this variant in other people? Are we seeing it in people who have cancer? Does it seem to stop the gene from working at a molecular level? So there's whole groups of people in research institutes, but also at the labs that are just kind of like studying all these different types of changes to understand what the actual impact is on cancer risk.
Excellent. So we're up against time here. We've gone a little bit long, but if you have any additional questions related to the genetics of LFS, please use Carly's email address there, carly@livinglfs.org. And we will actually make this slide deck available when we make the video, this recording, available as well, so that you can ask more questions if you have any. Carly, thank you so much for taking the time today. I really appreciate it.
Thanks so much for having me.
Absolutely. All right. In moving on, I would like to introduce Jackie Herigodt. She is the Director of Engagement and Partnership. I believe that is your title for Imerman Angels. They provide one-on-one cancer support, and they make the effort of matching people with people who have similar situations to their own. So I would like to introduce Jackie. Jackie, thank you so much for being here today.
An honor for sure. Can you hear me?
Sure can.
Okay, excellent. Okay. Thank you so much for the invite and the opportunity to chat with you all. I am honored, no doubt. So I really like to interact with people. I am not a fan of my voice, so and I find oftentimes I am talking to myself. So please, chime in. And all that to say is I'm going to start it right now with a question and hope that somebody responds to me on this question. So I know that there's a screen here showing something that probably doesn't look like the normal presentation or the expectation of what you thought you'd be seeing joining this this time together. So my question to you is, why would I show this screen? What is this a picture of? So what do you see when you're looking at this slide? Anyone?
A preparation for dinner in a restaurant.
That's right. It's a restaurant. That's true. So fun stuff. Yep. Social gathering. Yep. Absolutely. So a lot of times, this is the fun part, is people think, uh-oh, she's shown the wrong slide. Like this was something that wasn't supposed to pop up. But actually, it is intentional. You see, this is a restaurant. Super simple. Most people have been there. Most people have heard from someone else about a restaurant. Right. So somebody might say, go check out this restaurant, this new restaurant, or I went to this restaurant, blah, blah, blah. And so you'll have questions, right? Like, well, how do I get there? How is the service? Was it expensive? What do I wear? What should I order? Where do I park? And my favorite question is always, what was the best dessert? So, you're going to have these questions about something as simple as a restaurant, right? So you're going to ask somebody who's been there. We do this all the time. You talk to people that have more knowledge about a topic, right? So you might do that because you're really excited about an experience. So you want to learn more. You might do it because you're scared of something that you're about to experience. But ultimately, it is to feel more empowered about something that is unknown to you, right? So you want to talk to someone who's been there. Now, I swear this all ties together, so just give me a moment. You did not come to this presentation to hear about a restaurant. But in reality, it is this conversation of when someone gets diagnosed with cancer or a genetic mutation of cancer or being a caregiver to a loved one of cancer. So you want to talk to someone who's been there, who gets it. Because you're going to have questions like, how do I deal with this diagnosis? What does it feel like when there's chemo? What does it feel like when I have to have X surgery? How do I tell my family? How do I tell my children? And if you're a caregiver, you'll have similar questions like, how do I balance my life and my loved ones? How can I tell my children? How can I continue to work? What if my loved one doesn't make it through this process? Or even, my loved one hasn't made it through this process. How can I possibly move on with my life? And then there's also, of course, the receiving a diagnosis of a genetic mutation and wondering what it all means and what can you do about this, and really just talking to somebody who understands because they've been in that experience, right? So it's all about this power of connection. And we know that all these questions are happening every single day, and people are feeling very isolated and alone, and definitely like no one understands what they're going through. And I'm here to tell you that that is just not true. You see, I'm here from Imerman Angels. And Imerman Angels is that organization that fills that understanding gap. We are here to provide these personal one-on-one connections for all cancer fighters, survivors, previvors, and caregivers so that they have someone that truly understands. We envision a world where cancer is just not a solitary experience because it doesn't need to be. Now, why am I the one that gets to be here to talk to all you delightful people? And thank you again for this honor. I'm talking to you from my place of understanding. You see, back in 2012, when I joined the organization, I had already experienced the loss of my grandmother. My grandfather passed from cancer, my uncle, my aunt, and even my mom. And going through all those experiences, I cannot express to you the pain that I felt. And I knew I needed to do something with those experiences. I knew I didn't have the money to fund a cure. I knew that I didn't have the brain to find a cure. But I absolutely also understood and felt full-heartedly that I had enough experience and empathy to connect with others. And so that's when I fell upon Imerman Angels. And I knew that I needed a way to turn my pain into power. And Imerman Angels allowed me to do just that. You see, I became what's called a mentor angel. A mentor angel is a cancer confidant, a volunteer, a light in the dark room of cancer, someone that wants to share tips and tricks of what they've experienced and help someone else just lay some of that foundation and show what maybe somebody could expect. So I was able to become this mentor angel and feel like I could do something with these experiences and really help others so that they had something to understand, someone with an ear of understanding because they've been there. Now, a lot of times people are thinking, well, I went through this experience. What do I do with it? Well, in my eyes, I say become a mentor angel. we have been told time and time again that cancer and these diagnoses make people feel like victims. And yet becoming a mentor angel and helping someone else allows them to feel just a little bit like a hero. And then people wonder, well, okay, if I do that, well, how do I even become this mentor? What does that mean? Do you train us? And absolutely we do. We always tell people that the bulk of their training is their own experience. So we can't and wouldn't want to train you on that. But we do provide a Mentor Angel guidebook and a video that's interactive, and it has quizzes in it that you have to take and you have to pass in order to get certified. But once you get certified, you can actually print out your certificate, frame it, and put it over your fireplace and show it off to all your friends. Because we say it is like a promotion, a way to look forward and, allow you to gain some trauma mastery about what you've already experienced and to really help someone else. Now, what is happening with us as far as like location and how long have we been doing this? And I'm also going to explain the name Imerman Angels. So I'm going to be completely frank. When I heard Imerman Angels at the dog park, that over 12 years ago now, I actually thought the woman that told me about it said mermaid angels. Because what the heck is an Imerman? So I went home and I looked up mermaid angels, which didn't exist. And I was like, oh my gosh, I have to run into that woman again. I have to hear more about this organization. And so fortunately, I did run into her. And then I got clarification that Imerman angels is from Johnny Imerman. So he is a 2-time testicular cancer survivor. He was diagnosed at age 26, and he went through this experience with a ton of friends and family all by his side saying, it's going to be okay. You're going to get through this. It'll be all right. And while he was grateful to have their support, what he didn't have was someone there that really could tell him what it would feel like to date after cancer. He didn't have anybody that could tell him, like, well, this is what I did in order to have children after cancer, or anybody to tell him, this is how I got back in the gym. And at 26, those were his thoughts, his concerns, right? So it's kind of like if somebody tells you to go to a restaurant, and they're like, order this. This is how you get here. This is where you park. No, it's not expensive. Make sure you get this dessert. And you're like, awesome. Thank you so much for this information. When's the last time you were there? And then they just look at you with a blank face and they go, never. The information is just not as valuable unless you talk to somebody who's been there. Now, how long have we been creating these magical connections? We're going into our 19th year. And what we're doing is we're getting this mentor angel set up with a person that feels they need support. This mentor has had these experiences that this mentee, the person looking for support, needs. So we go ahead and make those connections. So we are doing this around the world, 123 countries with over 146 cancer types, and over 15,000 mentor angels have registered and trained with us over all time. And while that sounds like a lot, and I'm pretty proud of that number, I always want to be clear. We need more mentors. We need people just like you that have gone through this experience and they're looking for what can I do next, right? And we need people to be in our database so that if someone comes our way that is asking for support, that has had your experience, we have you to reach out to. So my call is always, please, if you're sitting there thinking about it, I guarantee you this is not a heavy lift. It really is. We reach out to you, we get you trained, and then after that, you'll be in our database until somebody comes our way that matches your experience. And sometimes it's 1 or 2 phone calls with this person. Sometimes it's through a treatment, and sometimes you become best friends. I've been connected to one of my mentees for over 11 years, and she's no longer my mentee. She actually became a mentor herself and kind of made me feel like a grandma. When she and I were connected, she was like my baby. And, our conversations meant so much to me and from what she says to her. So she then became a mentor. And then when she got matched, she reached back out to me. She's like, Jackie, this is what I said to my mentee. Was it okay? And I'm like, oh my goodness, I'm so proud of you. So, these relationships can go on for a very long time. And I'm grateful for that as well. So we are doing things like that for over 42,000 people you see there that have sought support, which ultimately means over 84,000 people, because in every match, there's 2 people getting connected. And you see, we have many partnerships and hospitals that refer to us. So now that you've been hearing all of this spiel, you may be wondering, well, how do I get to this organization? It sounds wonderful, Jackie. Yes, please. And so you'll go to our website here, imermanangels.org. Well, you'll go ahead and schedule your appointment. We'll figure out where you are and what you need. And then we'll make an introduction to a mentor or get you trained as a mentor. And then, like I said, the connection will be, started from there, and you all can take it the way you want, 1 or 2 conversations or however you deem needed. And the other thing is that, we recognize that not everybody has access to the internet. So we have put in the phone number here as well. And I will share the slides with Andy so you have access to the phone number if need be. But that's really your first step, is getting to us and getting in our system. Some organizations use paper referrals, so Andy can have access to that, and that would be if you call and talk to Andy or what have you, she can go ahead and send this over to us if you have a problem accessing the other methods of referring to us. But the important thing to know is that 97% of the people that do come our way, after we've surveyed them, they say that 97% of them would refer Imerman Angels. And I always say you wouldn't refer a bad restaurant, would you? So here are some of our peer-to-peer partners. So these are other organizations that refer to us for the peer-to-peer matching. But what's also beautiful is that when somebody comes our way beyond peer-to-peer needs, we'll go ahead and reference these other organizations and many more. So there's not all listed here. We also have other resources that are on our website at imermanangels.org/resources. And you can reference any of those. They're all free to use. I highly recommend checking them out. We have a lot of people that come our way that say these are so great for them and really helping them process their experience. And we do put in these community events. So I'm just showing these 2 slides as examples. We had an event all on caregiving and really breaking down how to experience caregiving, to navigate the system, and some positive, useful tools for caregivers. About 500 people registered for that. Then we had genes in cancer, like that broke down what is genetic testing, which you all know, cascade testing, and what are the differences between those and biomarkers in cancer, because not everybody understands all of these terms, so we wanted to break it down. Our next event is coming, which I welcome all of you. It is March 25th at 6 p.m. And you can hover over the QR code in the right-hand corner if that is easy enough for you to register for that. But it's breaking down psychosocial support. What does that mean? Why is that important to you to understand that terminology? And we'll have specialists in the field really describing that. So go ahead and register there, and I look forward to seeing you there. And that's really it. So thank you. Appreciate it. And just, again, want to say, please, don't be on the fence about peer-to-peer. It's not scary. We'll take care of you once you come our way. So thank you.
And I did already put the link to Imerman Angel's website in the chat. So if you want to follow up on that, you can just click on that link and get signed up as a mentor angel or to request a mentor angel. Jackie, thank you so much for taking the time today. I really appreciate you being here and helping everybody to understand the value of peer-to-peer, one-on-one support and hopefully to get involved.
Yeah, of course. My honor. Thank you. Appreciate it.
It is the birthday of our very own Jennifer Mallory. As I mentioned at the top, she is the founder of Living LFS, along with some of the board members who are on the call today. Trishia, Shelly-Stephens, and Ann Raymer was involved, and Jennifer Mills and Deanne Mooney, and so many other people in creating this organization and making it possible for all of us to be here today, for there to be an LFS family camp, for there to be hardship grants, and for there to be the support groups on Facebook where so many of us have connected and found each other. And I asked for the board members to submit some photos that they had from, their time with Jennifer. And so thankfully, Tom, who is Jen Mallory's uncle, is on the Tom, you're here, aren't you? Yeah, you are. There you are. It says that you're Carly Grant, but you are here. Tom was kind enough to provide us with some photos of Mallory when she was just a baby. Can you tell us a little bit about these photos, Tom?
Jen's dad and I were only brothers to one another, and so we saw a lot of each other back in the day until they moved out to Colorado. And there's just some pictures. That was, I believe, at a Christmas holiday on the far left there when she was just the littlest one, chasing around and crawling around. And she was always, and we got a little birthday party there. You can see Jen second from the left there with everybody wearing their hats, and another picture of her later. But we've got albums full of them. A lot of good times back in those days. That one there is appropriate for the just past holiday. That was a St. Patrick's Day gathering at the house. And you can see Jen kind of buried behind a couple of kids there. That's Maureen, my daughter, also an LFSer, and next to Jen is Amy, who was actually worked with the
One of our
LFS
founding
group
board
on the,
members, yeah.
in the board in the early days. And on the far right of Amy in the center there is Jen's brother Bob, who actually passed many years ago when Jen was still young. So. And there's just a picture of her petting our doggy.
Thank you, Tom. And then Jennifer Mills also submitted a few photos. So I don't have all of the details on these photos. Trish might have some of the details on these photos. Obviously, the one on the left is at the Pearl Harbor Memorial, and that they happened to get a rainbow that day. And then Mills and Mallory enjoying, I guess that would be snow cones or
Hawaiian shaved ice.
Thank you. Hawaiian shaved ice. And with Jennifer Mallory's husband, Phil, in the picture between them, no excuses, be a man. And Mills and Mallory with two of Mallory's daughters, Kira and Lily. And then this is me in the middle with Mallory, and on the right with Mallory with my husband, Jay Last, behind us. And on the left, that's board member Inge van Dormal, also with Mallory when she visited New York City and saw Inge there. And then these are photos of Mallory with her husband, Phil. The family. Mallory on the left with Bella, Kira, and Lily. And Bella, Phil. Oh, Bella, Dobby, Phil, and Lily. With the mutant mama. With her family, with Phil, her husband. And then, of course, the Living LFS board on the left. That's the founding members of Living LFS with Jennifer Mallory in the front. And then on the right, that's in Toronto in 2017. And that's Trish, myself, Greg Harper, who's on the call today, who's our former president, Mallory in front of him, hugging Deanne, who's our acting treasurer. And then, of course, camp. That was Jennifer Mallory's overarching dream, and she saw it realized in 2019. Trish, if you have photos on hand, which I know is a lot to ask, and you want to share them.
Oh, I have so many photos, and I
know.
apologize for not sending. I do. I have a lot of them, but oh boy.
She is the one that made all of this possible. She is the one that spurred all of us to be the organization that we are today. And she's our guiding light. Without Mallory, none of this would have happened. And so on that note, it is my pleasure to announce our hardship grants for this year. We were able to raise $6,100 since we gave out our last round of grants. And then our anonymous donor, we had a match period between February 6th and March 6th. We raised $14,359 during that period of time for a total of $20,484. And our anonymous donor this year donated $54,000 in total for families that have children with Li-Fraumeni syndrome, bringing us to a total of $75,000 awarded in 48 grants today. If you have a child with Li-Fraumeni syndrome and you submitted for a hardship grant, you will be receiving a grant. It's going to be sent out in the mail tomorrow, actually later today. I have them ready on my bed right now to put in envelopes and send them to you. And then Living LFS is awarding an additional 21 grants. So that's 27 from the anonymous donor, 21 from us for a total of 48 grants, which brings us to a total since we started this program in March of 2021 of $265,320 awarded in 254 LFS hardship grants. That is astounding. I can't even put into words how much this means to all of us. Deep thanks to our anonymous donor for making this possible. Thank you to all of you for participating. Thank you for spreading the word, for letting people know about the Hardship Grants program so that we can help as many families as possible in need on LFS Awareness Day and on October 5th, which is when the next round of grants will be awarded. Every March 20th and every October 5th, we do this in Jen Mallory's honor. So thank you all very much. That officially brings us to the end of the program. So if anybody has any questions or any thoughts they would like to share or anything else along those lines, please, now is the time to speak up. I appreciate all of you being here today as well. Thank you.
This is Trish. I got myself together to be able to speak just a little bit as a founding member. And one of Jen's closest mutant girls, right? That I am just so proud to see you all here and interacting on the Facebook page and with our socials and using any resource that Living LFS provides to you, because that was always Jen's dream. It was really about that connection, and that we know that Living LFS can be a very lonely, isolating, and overwhelming experience, both spiritually, mentally, physically, and financially. And as this all volunteer organization has grown from 2014 until today, to watch how much more of an impact we have been able to make by not only holding family camp, which was a dream, but by providing these grants, it is really fulfilling what her legacy was, is, and will continue to be. So thank you from the bottom of my heart for being here, and continue to reach out and to connect with one another. I know I could not make it through my personal LFS journey of my own cancers, my son's cancers, and losing my son without my mutant family. We are here for each other. So reach out, make those, continue to be involved, and continue to use us, because that is what we're here for. Happy LFS Awareness Day, and happy birthday, Mallory. I miss you.
And I had to very quickly find this. This is me and Trish and Jennifer Mallory in 2017 in Toronto. Anybody else have any thoughts they'd like to share? Tell us some memories of Mallory, or what you think about LFS Awareness Day or Living LFS, or your experiences with cancer and LFS or the community, or anything you want to share.
I'd just like to say that I just recently found you guys this last year, and the impact that it has had on me to finally have someone to connect with, because I am the only person in my family that has LFS. I'm that weird mutant. And so it's been a very lonely journey. And to get to connect with you guys on here and then go to camp last year was truly life-changing. And I just thank you so much for having this, for a way for people just not to feel so alone, a way to get some education and understanding, and just great support. So thank you very much.
Thanks for being here, Julie. And thanks for being at camp. And thanks. Julie is underselling herself. Julie is a nurse. And when we had our camp in 2024, she rallied the troops and brought tons of people to help us in terms of doing blood draws and helping volunteers to just do everything that we could possibly think of that was needed at camp. And it's people like Julie who really helped to make this community the supportive community that it is. So Julie, thank you. And I'm so glad that you found us and that you're part of the family. Somebody asked in the chat if there is going to be another camp. And yes, there absolutely is going to be another camp. We're in the process of planning for our 2026 camp. We try to do them in the even years now. And we haven't determined a location or anything like that yet, but make sure that you are on our mailing list. And as those details become available, we will send them out via email. And I think I have a link for... Let's see, we'll find the link to send you so that you can join our mailing list. Anybody else have any thoughts that they'd like to share? Kristen said, great job and great speakers. Thank you so much. Hillary says, thank you so much for all of the volunteers. Happy birthday, Jennifer. Her memory is such a blessing, such a beautiful legacy. Jackie Shenda says, so proud to be part of the family. My mom, hi mom, thanks for being here today. Says you all rock. Thank you to Jackie for Imerman Angels, who says it's an honor to be partnered with y'all, and thank you for all you do. Thank you. Thank you to our anonymous donor for making this the most successful LFS Awareness Day in terms of LFS Hardship Grants. This program wouldn't be anything without the support of our donors, and especially our anonymous donor, as well as Snarky Cancer. Trish, you're still here, aren't you? How many pieces of merch did we sell all total now?
Hold, please.
Hold, please, she says.
I will tell you this. So, and I want to also, say that you can buy merch all year long, right? And we have a collection of Living LFS merch, and we here at Snarky, because Trey and I both had it's a minimum of $10 per item. We don't make any profit off of it. It all goes back to the organization, and we do fundraisers for other cancer people who are cancering. And any of our retail stuff, 10% of all of the sales, not profits, all of the sales goes to Living LFS as well.
And I just put the link in the chat for Living LFS merchandise, including the shirts and the hoodies for today for LFS Awareness Day.
157 for the 2025. And then there were others. Some people, also purchased some of the other items past years. So, so far, just from t-shirt sales, I have already submitted $1,804. And then there will be a second check that will happen at the end of the month that I assume is going to be, another $300 to $500 just based on sales that came in after the pre-orders closed.
Fantastic. So yes, Specifically, I want to call out our anonymous donor, as I mentioned, the Addie Brady Foundation, who is a very generous donor as well, Snarky Cancer, that's Trish, who you just heard talking about the merchandise, Lon and Linda Humpert, Barbara Mills, Greg Harper, happy birthday to you just yesterday. He's currently running a birthday fundraiser. If you would like to donate to that, you can certainly do that on Greg's Facebook profile. And to all of our donors, here's a picture of the Snarky Cancer family along with this year's LFS Awareness Day merchandise. You can get that at snarkycancer.com. That link is in the chat as well. I'm grateful to all of you for being here today. Thank you so much. Happy LFS Awareness Day. The board and I have to get back to making phone calls to our hardship grant recipients. Thank you all so much for being here. Have a great day.
Thank you. It
Bye,
was great
everybody.
to see everybody again.
You as well. Bye.
Bye-bye.